Miss Midwife PeeJay channel. I have over for nursing students, especially those writing midwifery council exam 2026 in a few weeks. I compiled a book for midwifery candidates. I have four, I have 5,000 plus MCQ questions plus answer, and also explanation which will enable nurses and midwives to assimilate easier and faster. So welcome to my YouTube channel. I also have a TikTok account for nurses. I post MCQ question on a daily basis. So today we're going to talk about 5 ways to answer questions you haven't seen before. In every exam, there's every tendency that you see a question you haven't you in every exam there's every tendency that you get to see question you haven't heard or seen. So I'm going to tell us 5 ways to answer those questions correctly. And the first is use the ABC method. Example, if you see a patient has headache, vomiting and is not breathing, what will be your immediate line of action as a nurse? A. Give painkiller. B. Start CPR. C. Check BP. Then D. Give medication. You as a nurse, what should be your immediate answer? The correct answer for this question is B. B is start CPR. That should be your correct answer. Then 2 is assess before you act. You must assess before acting as a nurse, except in emergencies. For instance, a patient just had surgery and is complaining of pains. What will be your immediate response as a nurse? A. Assess the wound vitals. B. Give morphine. C. Call the doctor. Then D. Reposition your patient. For this question, your answer should be A, because the patient is complaining of pain. The patient is complaining that she's having pain and that patient just has surgery. So you have to assess the wound and check the vitals of that patient. The third is eliminate 2 wrong answers. Rule out any answers that are out of scope. Any answer you see that are out of scope, rule them out. For instance, if you see, what should the nurse do for a patient who has high fever? What should the nurse do for patients that has high fever? You as a nurse, what will you do for that patient? A. Therapy sponge. 2. Put ice water. C. Give aspirin without order. I used to give aspirin without order. Then D. Monitor temperature plus give fluid. What will be your first line of action as a nurse? As a nurse, once you see what should a nurse do for a patient with high fever, as a nurse, what will you do for a patient with high fever? The correct answer is monitor the patient's temperature. You know that patient has high fever, so you monitor the temperature. If you're just coming to my life, this is my channel for nurses. We encourage and help nurses that wants to write exam, those writing exam, and help them succeed. I also have a TikTok channel. You can go there. A TikTok page. You can go there. My handle is Teach with Learn with PeeJay. I also have MCQ 500 MCQ for nurses that will enable them succeed. It is just 4,000 naira. I post on a daily basis on YouTube, and I bet you have close to almost 100 plus MCQ that will enable you as a nurse to learn. So let's get to the next question. 4. You pick the safest answer. When stuck between two questions, choose the safest answer. Whenever you are stuck between 2 questions, you choose the safest answer. For instance, a patient on digoxin has heart rate of 54. What is the first line of action as a nurse? What will be your first line of action as a nurse? A. Give drug. B. Recheck in 1 hour. C. Hold plus notify the doctor. Then D. You document. The correct answer for this question is C. You know that digoxin slows the heart rate. Yes, digoxin slow heart rate. So giving it might cause cardiac arrest because your heart rate is less than 60 beats per minute. Your heart rate needs to be above 60 beats per minute for you to give digoxin. So you have to hold on and then you notify the doctor. The 5 is read the last line over and over again. Nursing and midwifery council are so long. Nursing and midwifery council questions are so long. They are so bulky. Read the last line and understand it carefully. Read the last line, understand it carefully. For instance, if they say Blessing is 32 weeks pregnant, she came in bleeding with BP of 80/50. Her heart rate is 120 and her fetal heart rate is 80 beats per minute. What should be the nursing priority? You as a nurse, what would be your nursing priority? A. Give medication. B. Take history. C. Give oxygen then turn to the left. Then D. Console the family. You as a nurse, what would be the nursing priority? The correct answer for this question is B. You take the correct answer for this question is C. You give oxygen, then you turn to the left side. Then, like I said, I have the 3 things you must do as a first time student writing any exam. If you're about to take any exam, nursing exam, any school exam, 3 things you must do so that you enable you to pass it once and for all. First of all, do not cram. If you're writing an exam, try not to memorize. Try not to cram. Understand that question. Understand that particular question. Understand it, assimilate it, and also let it sink into you. Let it stick into you. The second is the second is practice memorizing. Yes, practice repetition. Once you repeat something, they stick into you. Once you repeat stuff, they get into you. Once you practice, once you repeat any question over and over again, they stick into you. Like I said, welcome to my YouTube channel. This channel is basically for nurses. Yes, for nurses, nursing students, nurses, and also aspiring nurses. If you are an aspiring nurses, and if you're a student nurse, I post MCQ, multiple choice question for students that enables you as a student become the better version of yourself. That enables you as a student to pass your exams. Yes, to pass your exams. And um, I have a book that contains 500 questions MCQ for nurses. 500 questions MCQ for nurses. It is just 4,000 naira. If you need the book, just email me on my email. It is on the bio. Email me. This is my YouTube channel. So thank you for joining us and see you. Bye.